Okay, our penultimate presentation is coming from Ernest Davis, and I will give you the clicker so you can introduce yourself. Thank you very much. Take it away.
Thank you. My name is Ernest Davis, and I am building a health optimization app with a proprietary algorithm that allows for patients to stay in contact with their physicians outside of the medical setting so that they can reach their optimal health status and the health system can reach their population health metrics. Why am I doing that? Well, I have 3 kidneys. And the day that I found out I had chronic kidney disease, a lot got thrown at me in terms of care plans from my nephrologist, from my primary care doctor, from my nutritionist, from all over the place. And I was just in the backyard playing with my kid. So being told that you gotta change your entire life without actually talking to me as the patient to figure out what I wanted out of my goal, I said, this isn't right, but I gotta figure this out. Unfortunately, everybody doesn't have 15 years as a hospital administrator behind them to be able to understand the complexity and sometimes opacity of the healthcare system. So when you are thrown into the hospital, you get a lot of resources flown to you, but only about 10 to 20% of your health status is due to that medical care. Another 60% is around your health behaviors and your social determinants of health, not to mention your genetics. I'm not touching your genetics. However, there is a better way. So SoCon Health is built so that the physician and the patient can stay in contact outside of the medical setting through achievable health and care plans and through an AI that will allow for the patient to stay in regular contact with their care team so that they can reach their care goals and the physician can watch to see the progress towards those goals. Now you say that sounds really important. You're right. And there's a lot of people that are in this space. However, not many of them are focused on health facilitation. They're focused on medications, they're focused on home health, but not that patient activating themselves as the owner of their care and being an investor in their care instead of a customer in their care. So we believe there's a little bit of blue ocean in there. But the market is significant. So there's 20 billion in the value-based care market in America right now. That's gonna continue to grow at about 19% compound annual growth rate. In Cincinnati specifically, there's somewhere between 80 and $130 million per year in the value-based care sector, and that's going to grow to about 700 million by 2030 based on some legislative changes that are going on. So SoCon Health believes that if you can increase the communication between the patient and the physician, you can do better goal setting with the physician, and you can have more timely and better interventions with that patient. Now, for me, that intervention was getting a kidney. However, everybody's not gonna be at the quaternary level of care, right? Some people are still goal-oriented like me, looking to improve their A1C, but some people just wanna spend some time with the grandkids. And some people wanna just make sure they can walk their daughter down the aisle. We aim to help people with that outside of the care setting. So how would SoCon Health work? Well, look at this strapping gentleman up here. That's young Ernest, before he knew he was sick. So let's say that he was told that he had chronic kidney disease. He needed to start dialysis. There's a care plan that is spit out by Epic that everybody else is getting as well. But I know I need to lose weight before I can get a transplant. So somebody from SoCon Health, a community health worker, comes to my house, helps me understand all of these different care plans that are getting thrown at me, and listens to me to see what my goal is so that that can be integrated with the other goals from my care team. Now, there's an AI and an app. The app is introduced to me so that I can understand there's gonna be a call after I have dialysis every time, 3 times a week, and it's going to ask me, did you lose weight? Did you get the fluid taken off of you? Did you cramp up? Did you feel dizzy afterwards? Were you able to drive home? And how are you doing towards the goals that you need to be able to be on a list somewhere? Now, all of that gets thrown through an algorithm so that if 10 days in a row I say I did not lose the fluid that I needed to, my doctor is alerted immediately, and we can change my care plan so that I can get to my goal and they can reach their population health goals that I am tied to because of, well, that's how chronic kidney disease works. So now I have a new care plan that is just as much me as it is my care team, and it's something that I can work towards. So we believe that we can get started with this by next year, have a pilot by the summer, and be ready to go to market by the beginning of next year, just based on a really good team, community health workers, and one person that works for another company that was on that matrix, and I can't tell you who it is until our contract is out. So we're working on that right now. However, we do believe that we need a co-founder that is going to help us with predictive analytics and building that algorithm, and what I call a chief dot connector, somebody that understands the venture capital space, somebody that understands entrepreneurial ventures on a level that I do not, so that we can continue to move forward. So we are SoCon Health, and I'd be happy to answer any questions.
Thank you, Ernest. Excellent. Does anyone have any questions for Ernest? Yes, sir.
Ernest, this may not be a fair question. I know going in, you're doing a presentation, but a big part of it, you really lead into your care. You were probably ideally suited for this. What happens when you have patients that are in denial or aren't willing to be engaged? Have you thought through that part of the business and how you might address the complexity?
Absolutely, and that is a big problem with the current state, because a nurse is coming to your house as a home health a nurse or a home health aide is coming to your home. The physician that lives nowhere near you is trying to tell you what your care plan needs to be. And that's why we're leaning into community health workers. People who understand that specific community, people who are tied in. We might be going to church together. We might go to the same gym. There's different ways that can create a familiarity with the patient that allows for them to tell you about their most intimate goals, that allows for them to tell you about the fear of walking outside to get a little bit of exercise because somebody gets shot every week. So that community health worker is a little bit of our secret sauce. I can't believe I'm saying that on camera right now, but that's definitely a part of our goal to change that current state into a beautiful future state. It's a fair question. I liked it. Mm-hmm. Yes, sir.
How much time is required from the care plan team or even doctors to interface with SoCon Health? And then is there any incentive for them to interact with the app and keep track of what you're doing?
So unfortunately, the way that it stands right now, when you leave the physician's office or you leave the hospital, Epic or whatever electronic health record that the hospital or health system has just spits out a care plan for you. And the nurse and the doctor that are working with you edit that with maybe 3 or 4 sentences. That is your care plan. And all of these different pieces of that health system are doing the same thing. So that's what we get. That's what SoCon Health would need to start your care. But then there's also the best practice, that's what I was trying to get to. Best practices that are in the literature that I work with on a regular basis in my current for-profit venture that we would load on top of that and then add on top of that the sauce of what the patient sees as their goal. So there's very little interaction on the front end that the health system would need to have with us. On the back end, doctors don't like to have a lot in their inboxes for the EHR. So we have to have that algorithm that's going to scrape off the most important pieces for your DRG or your diagnosis code to say, these are the things we need to be worried about, right? And then only the things that are most important to that patient's care is what makes it into their inbox. So they know, oh, this is SoCon Health. I need to go and contact that patient immediately because most likely this is something that's going to decompensate them, get them back into the hospital, and I'm going to lose out on my value-based care metric. Long answer, I'm sorry.
All right. Thank you very much, Ernest. That's great.